You may begin your presentation now.
Hope is the crack of light in a room of darkness, the promise of a new day, the eclipse of a new beginning. Hope enacted upon is one of the most powerful things that we can do. And that's just what we've done. We've transformed hope into reality through QUT Changemakers. Now, QUT Changemakers was QUT's first social entrepreneurship competition, run earlier this semester, which was the crack of light in a room of darkness for so many. Through this program, we've engaged QUT and Queensland's communities to become a changemaker themselves. Now we are the changemakers of QUT. I present Changemaker Patrick. He founded the project Best Foot Forward, which sells accessories featuring Indigenous designs to ignite, to encourage, to inspire active discussion of Indigenous art, history and culture, while also reducing the literacy gap. I present Changemaker Olivia. She founded the Unknown Project, which seeks to dramatically alter people's perceptions of refugees while also providing necessary resources for them. And I present Changemaker Lily. She founded the Health Review Bot, a chatbot that identifies patients in GP clinics for mental illness risks who otherwise would have gone undetected. And me? I'm Chelsea, President of Enactus QUT, and here, along with our Changemakers, we will present 3 out of 6 projects, all audited and achieved in this financial year. Now, Enactus has always said that impact is so much more than financial outcome. There's a much more holistic approach. Therefore, we will be demonstrating and communicating our holistic impact through natural, social, human, and physical assets as well. But for now, I introduce you to Changemaker Patrick.
Before I begin, I too would like to acknowledge traditional owners of the land on which we meet today, the Gadigal people, as well as their elders past, present, and emerging. It's important to recognise that this land is, was, and always will be Gadigal people land. Now, before attending university, I attended a humble high school in central Queensland. At least half of the students who went there came from remote Indigenous communities in the Torres Strait Islands. Now, whilst this gave me the phenomenal opportunity to foster meaningful relationships with so many of these students, some of which continue today, it also gave me a glimpse into the challenges that these students face daily, challenges in the realm of literacy and even cultural pride and awareness. Only 60% of Australians state that they are proud of Indigenous art, culture and history. Moreover, only 78% of Indigenous Australians meet the minimum Year 3 literacy standards, as opposed to 95% of non-Indigenous Australians. In fact, literacy is such a challenge that it forms the cornerstone of the United Nations Sustainable Development Goals around education. So I asked, how can we fix this? How can we ignite passion and pride behind Indigenous art and culture whilst also accelerating Indigenous literacy rates? As a QUT Changemaker, I turned this problem into an opportunity with Best Foot Forward. Now, Best Foot Forward provides clothing accessories featuring Indigenous designs from the Dreamtime. We source those designs through local Indigenous artists who also receive a portion of the proceeds. To date, Best Foot Forward have produced socks, pocket squares, and scarves. But we also understood the importance of validating the fact that we are actually making impact in the community. And what better way to do this than to actually engage with local Indigenous artists? Artists like Maurice Woodley. The feedback was overwhelmingly positive. Maurice states how important it is for all Australians to recognise that we're part of a 60,000-year history, not just a 250-year one. He also states that Indigenous Australians have the largest, longest ongoing living culture in the world. He says that something so precious like that needs to be marketed, branded, talked about and owned by all Australians. And that is exactly what we are doing here today. And when you look at the impact of Best Foot Forward, it far exceeds the sale of clothing and accessories. We've created a unique way of inspiring conversation and awareness around Indigenous art and culture. We've maintained environmental sustainability by using environmentally certified cotton materials and manufacturing practices that are done here in Australia. We have created new sales channels for local Indigenous artists, empowering them to be able to continue to sustain their own passions. We've also created additional sales channels for our partners, the Kirrawee Indigenous Corporation and the Indigenous Literacy Foundation. And we have also enabled the Indigenous Literacy Foundation to continue their efforts in promoting Indigenous literacy throughout the community. But that's not all. This year, to date, in 6 months, we have made over $4,300 in sales. At average revenue of $21.50 per customer, that means that over 200 more Australians are now more aware more proud of Indigenous art and culture. Now, we give 50% of our proceeds to our partners, the QUT Indigenous Corporation and the Indigenous Literacy Foundation. Now, that means that the Indigenous Literacy Foundation can use those proceeds to sustain their efforts like providing 260,000 books to remote Indigenous communities. That means that the QUT Indigenous Corporation can continue to sustain their efforts in igniting pride in young Indigenous Australians in the Gold Coast, as well as enabling them to continue to learn their native language. That means that local Indigenous artists can continue to sustain their own passions. But we're not stopping there. For the next financial year, we have an objective to achieve $15,000 in sales. Sales that will help us to continue to make reasonable and more than substantial bounds and strides to promoting the United Nations literacy goals, primarily to achieve greater literacy rates for adults and children by 2030. And now, as we're beginning to develop even more and more, we recognise that we need to go beyond just the provision of proceeds. We want to be on the ground. We're going to start workshops that inspire young Indigenous Australians to create sustainable enterprises themselves, enterprises that encompass Indigenous art, culture and history, enterprises that can, like Maurice Woodley says, market, brand and talk about Indigenous art and culture. We're igniting that pride in Indigenous art and culture whilst also accelerating Indigenous literacy rates, enabling all Australians to put their best foot forward. If you want to find out more, or if you want to pick up a pair of socks yourself, head over to bffclothing.org.
Now Olivia will discuss the Unknown Project.
In 2015, we saw the greatest exodus of people worldwide since World War II. And by 2016, the United Nations High Commissioner for Refugees estimated that 65.3 million people had been forcibly removed or displaced from their homes. That's 1 in every 113 people worldwide. That's almost 24 people a minute. And half of those are children. And for those young people who seek asylum in Australia, settling into new schools can be extremely difficult. They're facing language barriers, a whole new education system, and often dealing with some of those traumas back in their home country. But ultimately, it's schools that provide the access to resources and opportunities that come with transitions to citizenship and belonging. So my question for each of you here today is, if any one of those young people do choose to come to Australia, will they have access to the resources they need? Well, as a QT changemaker, I saw an opportunity. Introducing the Unknown Project, a blind date with a book supporting access to education and opportunities for young people from refugee and asylum seeker backgrounds here in Australia. In developing our needs analysis in partnership with the Romero Centre, a refugee support agency up in Brisbane, we established that these young people face significant informal barriers to accessing education, namely access to resources, most importantly technology, social exclusion through extracurriculars, and geographical access. It was the absence of these elements that meant they weren't able to engage with a meaningful education. From there, the Unknown Project concept is a simple one. We take donations of quality secondhand books, wrap them in brown paper, and write 3 clues on the front as to its themes, similar author, or genre. Think, don't judge a book by its cover. We sell these for $5 at markets and events around Brisbane. To date, we've had 5 market stalls, catered a conference, a yoga retreat, and most recently, a wedding. But what really sets us apart is our social message. Don't judge a book by its cover. And how often were we told that as kids, right? But I know my mum, she was never talking about books. We think the books act as a great metaphor for the rhetoric and the treatment of asylum seekers and refugees here in Australia. It speaks to the enormous and largely untapped potential of these groups. And it stands for a fair go for all. In partnership with the Romero Centre, we utilise our proceeds to purchase much needed school supplies for Romero's clients. This starts to bridge the gap in access to quality education as we move towards the UN Sustainable Development Goals around education. To date, we've received donations of 1,200 books, sold 600, engaged 120 volunteers, and have been able to provide to the Romero Centre 30 school supplies packs and 20 Microsoft Surface Pro tablets. We estimate that we've directly impacted 50 young people through access to technology, increased leisure time, increased time with family, and reducing that financial strain. In 2017, we also received an award of $5,000 to continue to grow and scale our impact. Our revenue to date is $3,000. Now, what became clear was this connection between education and employment. So looking forward, we've developed a partnership with Multicultural Development Australia, another refugee support agency in Brisbane, to deliver professional development workshops to their clients. These range from English skills to presentation skills to digital literacy, and we've been able to roll out 10 of these so far. Our community partners to date are the Romero Centre and Multicultural Development Australia, who are our main resource recipients. Our main book donors are the Children's Book Council of Australia and the Footpath Library. This past semester, we were also lucky enough to be selected amongst Brisbane's top emerging social entrepreneurs in Impact Boom and Tom Allen's social enterprise incubator, Elevate, culminating in a pitch at the Brisbane Powerhouse for Lord Mayor Graham Quirk. Ultimately, the Unknown Project is fundamentally centred around community and storytelling. Our shared experiences, the human condition, a great book. We want to see a Brisbane and an Australia where everyone is empowered to speak at the table. If you'd like to hear more, please head to theunknownproject.org.
Now Lily will discuss the Health Review Bot.
I'd first like to introduce you to Ben. He's been struggling with his mental health for a while now and doesn't know who to turn to. He heads to the GP for a rugby injury, but doesn't have time to mention his mental well-being. A few weeks later, the rugby injury has healed, but his thoughts remain. So how can GPs, who see 80% of Australians at least once a year, become more involved in our mental health? As a QUT changemaker, I turned this problem into an opportunity. What if every patient who walked into a GP clinic across Australia was screened for mental health, rather than relying on those already struggling to raise this stigmatised issue? What if doctors had access to a patient's mental health history, allowing them and their patients to move between GP practices to cope with our increasingly busy lifestyles? And what if we as a nation knew which suburbs were struggling and could redistribute resources efficiently to better cope with our mental health crisis? Well, the Australian Bureau of Statistics estimates that mental health accounts for 24% of the non-fatal disease burden. Health Review Bot begins with a QR code patients scan to have a virtual chat about how they've been feeling. This chat is based on the internationally recognised depression, anxiety, stress scales, and calculated scores are sent instantly to their GP. With this, the GP can address any issues raised by the DAS. Not only does this provide a short-term solution for the time-pressured GP, but more importantly, a long-term patient wellbeing plan. But this goes beyond the individual. This would allow us as a nation to gain a scope of this mental health epidemic. So validation was achieved through primary research of 87 patients, which found that 68% wanted to be asked about their mental wellbeing, and 62% would be happy to chat about it on their phone. However, of 10 GPs and 30 clinics, none screened every patient. We launched our MVP at Mina's Medical Centre and screened 26 patients, identifying 8 at risk. That was 8 lives we had already impacted. A follow-up 6 weeks later revealed that one of these patients had successfully implemented their mental health treatment plan. We have a goal to partner with 50 clinics, but realistically estimate 10. Still, with just 10 clinics, we would reach predicted sales of $4,800 from GPs alone. Additional revenue would come with ad hoc work, such as our current project with the Supreme study of the Mater Research Institute, a hospital in Brisbane, and the University of Queensland's medical research team, which to date has earned us $360 and will screen 1,500 patients over 3 years. But our impact is far more than quantitative. We are aligned with the United Nations Sustainable Development Goal of good health and well-being for all people. The World Health Organization predicts that mental health will be the biggest cost driver of health for nations by 2025. Early intervention allows individuals to improve their financial assets. Human assets are also improved through the development and the introduction to the resources that they can access. And where mental health research emphasises the importance of individuals identifying their support network for times of crisis, the Health Review Bot fosters these relationships, building a connection with the GP and the patient for future conversations. But our work is far from over. Our research arm will continue with a $40 per month maintenance fee, and we are also in negotiations to receive $100,000 in funding, be part of research with eHealth Queensland, and gain national certification from GP governing bodies to increase our uptake. Health Review Bot provides Australians with the hope that it can get better. Not only does it save millions of dollars, but more importantly, millions of lives.
Through our projects, Enactus QUT continues to make impact by partnering with leading organisations and engaging the wider community. We have ignited pride in Indigenous culture, art and history, while also reducing the literacy gap. We have altered people's perceptions of refugees while provided educational resources. And we've actually identified people with a mental illness who would have otherwise battled it alone. We are the change makers of QUT. Thank you.
We will now begin the question and answer session. Judges, please feel free to ask your questions.
Yes.
Phenomenal projects. The question I've got is regarding the Health Review Bot. Really great idea.
Yep.
What's the cost for a GP to have that on board in their clinic?
So you mean what we charge them?
Yeah, correct.
Yeah, so it's a $40 per month fee. So, and compared to the fact that not only do we simplify the process of having it on paper, it also provides that long-term impact, and that's something that otherwise they would have to ask their receptionist to input the data and all that kind of thing. So it saves time, and we do believe we're adding value. So yeah, $40 a month.
Second question on that as well. For the clients that are deemed at risk,
Yeah.
through your messenger bot, are you using Facebook for that?
No,
Oh,
of
it's
course
just,
not.
oh, okay. So it's not done
No.
there. Are you then sending them further information and like suggested programs for them to be able to improve their mental health outcomes, or is it purely just a feedback piece for the doctors?
Yeah, so at this stage it is a feedback piece. So it'll send to the doctor immediately. So before the patient enters the GP room, it sends them their score and the different bands that they're in. And so that's sort of what it does at the moment. But they can also follow up with that patient. So like that 6 weeks later, when they track that patient, they can see the impact that they're having and whether it's working, whether it's not, evaluate how they're going with that. So.
Excellent.
Thank you for the great presentation. Quick question for Best Foot Forward. Can you tell me how I'm curious about how you created a link between the sales of the socks and the 200 Australians who are now proud of culture and so on?
Right. Good question. So ultimately, the power of being able to sell online means that we have the access to all the figures which give us a comparison of the amount of transactions compared to the amount of products sold. So we've made over $4,000. Actually, in fact, in the past week, we actually have made an additional amount of sales of $1,500. But so with that $4,000 figure, we were able to calculate that we had an average revenue of $21.50 per customer. And so then from that, we were able to roughly ascertain that we have around 200 more people who have, had these access to these designs and the stories behind them.
Thank you for that. Maybe I worded the question poorly. The link back to pride. So I get that there were 200 people who purchased it,
Yep.
but the statement said that resulted in 200 additional Australians who had pride in the culture. I'm just interested how you came up with the pride concept.
Absolutely. So being within 6 months of its life stage as well, I think that it's important to note that we haven't necessarily completely laid out any metrics that we are hoping to plan out for the future in terms of actually measuring engagement and the conversation that's been raised throughout this. We plan to do that once we develop a stronger presence on social media. But ultimately, through our tests and through idea validation with local Indigenous artists like Maurice Woodley, who've been able to validate the idea, and it's consistent validation across all the artists, and say that this is the sort of thing that's required to really induce that pride.
Going back to Best Foot Forward, who owns the designs? Who owns
So-
the IP on that?
Sorry?
Who owns the IP on that?
So the IP, we ultimately can't necessarily have access to the IP. But the main thing is that the reason being is that there are so many different designs out there. And this is ultimately, in effect, helping to assist in another problem, which is the fact that in discount stores, sometimes we're having different Indigenous designs that are being made overseas, and they aren't authentic Indigenous designs. They're being sold for $2 a piece. And that is ultimately incredibly affecting local Indigenous artists like Maurice Woodley, who try and do this for a living. So yes, the idea of IP is a tricky one. It's something that we can't overcome, but the idea that we're creating that social impact and we're making a name for ourselves in that regard kind of overcomes any IP issues that we will have.
Just a quick one on the Unknown project. It seems like there's a lot of volunteers and a lot of effort going in.
Yep.
How can you harness the kind of ripple effect of that
Yep.
from a communications perspective? Because it's a great project locally.
Yep.
And it's almost can you harness that and communicate that a bit more broadly to
Yes.
change the feeling
Yes.
of these refugees coming in, that people care,
Yep.
and allow the project to even do more good further afield,
Yeah. Great question, thank you. So looking to the future, we want this project to be one that is community owned, because I think there is great connection in that, in forging new communities and having this cross-cultural exchange rather than a one-way, this word integration that we hear a lot. So one way that we have been trialling, and we'll be rolling this out as well throughout next semester.
Time has expired. Judges, please join me in thanking the Queensland University of Technology.